Hi there, I'm Nathan Turnbull, an orthopedic surgeon with Florida Orthopaedic Associates. Today I'm going to answer some patient questions about joint replacement surgery. We have a patient, Michael, who asks, what is Makoplasty knee replacement? Makoplasty knee replacement surgery is a robotic-assisted technique to performing a total knee replacement. We can also perform partial knee replacements with Makoplasty. And it's robotic assisted. The surgeon is still performing the surgery. It's the same saw that we normally use to make our cuts. One example is the tibial cut, one of the cuts on the tibial bone. We make our cut with the saw, and the saw is attached to a robotic arm. And the computer sets our alignment. And you go for a CT scan beforehand. The computer makes a three-dimensional model of your knee, so we know what size your knee is prior to performing any surgery. We perform all of our surgical planning in the week or two prior to the surgery, so I know what size you are, I know exactly where I'm going to put my implants, and then during the surgery we register the robot and we can make changes before we make any cuts. But the robot helps align the cuts, make sure that I don't make any errors and turn my hand one way or the other, and keeps the alignment during the surgery. So it's called robotic assisted because the surgeon still has control of it, but the robot is assisting with the alignment and implant placement.